Welcome to the presentation for congestive heart failure. At the end of this presentation, please navigate to the exam for congestive heart failure and complete that to the best of your abilities. What is congestive heart failure? When your heart is not pumping as well as it should, blood and fluid back up into the lungs, congestion, breathing is harder. Heart also cannot supply the cells of the body with enough oxygen, which creates fatigue. Usually there is no cure, and this affects nearly 5 million Americans. What are some of the causes of CHF? Heart attacks, high blood pressure, abnormal heart valves, lung disease, diabetes, low blood count, thyroid disease, heart arrhythmias, and drugs such as cocaine and alcohol all cause CHF. What are some of the signs and symptoms of CHF? A shortness of breath, often with activities or while lying flat, weakness and fatigue, awakening short of breath at night, a need for increased pillows at night, which helps the lungs drain of excess fluid, coughing and wheezing, swelling of the feet and legs or other dependent areas, anorexia and loss of appetite or weight gain. Diagnosis: electrocardiogram, ECG or EKG, chest x-ray, echocardiography or an echo, heart catheterization, stress tests, and blood tests are all ways to diagnose it. Treatment: lifestyle changes, monitoring for changes, medication, and surgery all would help. Treatment for lifestyle choices: exercise and physical activity, nutrition, a diet of low saturated fat and low salt or sodium, losing weight and quitting smoking, avoiding alcohol, modifying your fluid intake, and monitoring disease, weight, swelling, medication, and signs and symptoms. Exercise: general recommendation is 30 minutes most days of the week. Specifics may be different for different people. Check with your doctor about what type and how much. Always want to start slow and build up gradually. Nutrition: low salt and sodium and low fat. Losing weight: basic guidelines are to go slowly, eat a variety of healthy foods, and avoid the trending or limiting diets. Two approaches that work best when used together are to reduce the number of calories taken in, eating foods low in added sugar and fat with high nutrients, and burning more calories by becoming physically more active. Smoking: cigarette smoking is the biggest preventable cause of premature death in the United States. Encourage your patients to quit smoking. Each year, more than 1.3 million smokers quit. With a good program to help, 20 to 40% of those who try stay off cigarettes for at least a year. Healthcare providers can suggest stop smoking plans, but quitting is really up to the individual. Alcohol: limit your intake. At most, 1 drink per day for women and 2 drinks per day for men. 1 drink is the equivalent of about a 12-ounce beer, 5 ounces of wine, or 1.5 ounces of a spirit. Modify your fluid intake. Different people may have different restrictions. Accurate records can help provide understanding for how much a person can manage. Always consult with your doctor before restricting your fluids. The treatment for monitoring for change: daily weights, swelling, medications, and changes in signs and symptoms. Daily weights: weight gain can indicate the body is retaining fluid, which is dangerous for a person with heart failure. It makes the heart work harder, and it might mean the person needs a change in treatment. Tips for accurate daily weights are to weigh every day at the same time, on the same scale, in the same type of clothing. Record the weights and notify if the weight is out of range. Monitoring for swelling: check the body, the legs and feet, hips and buttocks if sitting a lot, stomach and back if in the bed a lot. Check their clothes and their shoes, tight, marking the skin, modified, cut, and ask the person. Warning symptoms: increasing shortness of breath, increasing coughing, chest pain, leg swelling, shoes are tight, weight gain, increased pillows at night, and fatigue and weakness. Warning signs: decreased oxygen levels, increased heart rate, pulse, increased respiratory rate, edema in the extremities, weight gain of more than 3 pounds over 3 days, and not taking medications. Treatment for medications: medications help to improve circulation of blood by strengthening the heart muscles, pumping action, and expanding the blood vessels. Medications can also help to reduce the amount of water and sodium in the body, which in turn reduces the heart's workload. Medications. Take all medications as directed. Take meds even when the person feels okay. The medications might be the reason he or she feels okay. Surgery. Angioplasty, coronary artery bypass graft, a heart pump, and a transplant are all methods. Why is it important that we do a better job managing CHF? It will improve the quality of life, improve function, abilities, and independence, promote length of life, reduce hospitalizations, and reduce the cost of care. This is the end of the presentation. Please proceed to the correct exam now. Thank you.